On today's episode, I'm going to break down how to avoid looking like a duck after lip filler. We've all seen it. It's all over social media. People are looking unnatural, overfilled, and it's often something that can deter you from getting lip filler. I'm going to take you step by step exactly what we can do to avoid looking like a duck. Welcome to the Perfect Dose podcast. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. On today's episode, I'm going to break down how to avoid looking like a duck after lip filler. We've all seen it. It's all over social media. People are looking unnatural, overfilled, and it's often something that can deter you from getting lip filler. And I want to explain to you guys that lip filler can actually look natural. There are ways that we can prevent migration. There are ways that we can prevent looking like a duck and looking overfilled. So on today's episode, I'm going to take you step by step exactly what we can do to avoid looking like a duck. So number one step to avoid looking like a duck after lip filler is stop overfilling your lips. This is something that is happening way too often. Every person has a different lip shape, a different lip size, different anatomy. So when you're coming into my practice and you're like, how big can I get my lips? I will always tell you one thing. I say this to every single one of my patients. If you're listening and you've seen me in practice, you will know I will tell you, I will inject as much as your anatomy allows. And what that means is I cannot physically put more filler into your lips if your anatomy is telling me no. If your lip tissue is very thin, you don't have a lot of room for lip filler, then I'm not going to be able to inject as much product as somebody that has bigger lips, that has naturally juicier lips, and that their lip tissue can hold more filler. Now, what I mean by that, when I say I can't inject more than your anatomy allows, it means a good injector would never inject more than your anatomy allows. This is how you look overfilled. This is how people look like ducks. If you inject more than your lip tissue will naturally take, that filler isn't going to stay in the lips. It's going to start pushing around your lips. So I'm going to explain a little bit of what lip anatomy looks like and what it is so you guys can visualize this with me. So on the lips, we have a border and it's called your vermilion border. That border is going to separate your lip from the rest of your face around your lip. We also have a wet mucosa border. So you have a dry area, a wet area of your lip, and then you have this border around your lip. When we're injecting lip filler, we have to stay beneath that vermilion border and above that wet border. So there's actually a very small space that varies person to person that we can actually safely inject filler to avoid overfilling the lips. Now, the next thing that we can do to make sure that you don't get overfilled is framing around the lips. Lip framing is the most underrated thing talked about on social media and in injectors' offices. I have patients come into my office all of the time and they're like, I am here for my lips. Why are they here for their lips? Because we see ourselves two-dimensionally. So when you look in the mirror, you're like, okay, something's changing in my face. I feel like adding my lips will make me look more youthful, more refreshed. It's the first thing I'm seeing. But our job is to make sure that we assess your face in a three-dimensional view and that we're looking what is around your lips to make sure that your lips are supported enough to tolerate filler. So if your lips need support around them, and you just get lip filler, your lips can look like a duck. Your lips will migrate, they will look unnatural, they will project forward. So it's important that we inject around the lips and frame your lips to add that structure and support. So where might we be injecting when I'm talking about lip framing? So when I'm talking about lip framing in my practice, I'm talking about adding filler to areas around the lips that are gonna balance your face and that are almost going to give you a lip lift. It's going to trick you into looking in the mirror and being like, wow, my lips look bigger without any filler. So key areas that I inject for lip framing are the piriform space. The piriform space is a space right by the crease of your nose and your smile line, and injecting filler in that area will actually lift and evert the lip. Another way to frame the lips is adding filler in your cheeks. If you need structural support in your cheeks and you have hollowing and fat loss in your mid-face, if we don't first support and lift that area, filler can look over projected and overdone in the lips. The other place that we need to frame with filler, and this is like my favorite framing area, you guys, is the chin. And chin filler will change lives. And this probably is the most important area to frame because if you are a candidate for chin filler and you get your lips done, your lips will absolutely project forward. Ideal proportions for a female is for our chin to project slightly more forward than our lower lip. It's something that we as injectors can assess for and determine if you are a better candidate for chin filler than lip filler. And if you go to an expert injector, you go to somebody that really knows what they're doing and you come in for lip filler, but really you need lip framing with chin filler first or cheek filler, they will tell you no. I tell my patients no more often than I say yes in my practice. And I tell them I care about their outcome. I see them from a three-dimensional perspective. So if I'm telling you no and I make money when I say yes, you better listen to me. It is very, very important to balance your face. And framing around the lips is how we not only avoid looking like a duck and overfilled and unnatural, but it's also how our filler is going to last longer because we need support around those areas in order for our filler to have a longer impact. Now, the third thing I want to talk about with avoiding looking like a duck after filler is product choice. And this is so important, you guys, because all filler is not alike. Fillers are different. They vary by how they look, how they feel. Fillers have different personalities is how I like to describe them. And some fillers' personalities are very firm, very structural. Then other fillers' personalities are very flexible and smooth and stretchy. So pending your lip shape and your lip size, we will determine what product is best for you. Now, fillers can range from very hydrating, adding no volume, no definition, simply hydration, to fillers that add a lot of structure, a lot of definition, and even fillers that add a lot of plumping and volume. So we will determine which product is best for you based on your lip goals and what your anatomy will allow. Now, another important thing other than product choice and lip framing and making sure that we avoid over injecting the lips by adding too much filler when your lip can't handle it is making sure that we go slow and steady with lip building. And lip building is really great because maybe you come into a practice and you're like, well, my lips are small, but if my anatomy will allow it, I would love to get them bigger. And that's absolutely possible. The key to lip building is making sure that we go slow and steady. And I'm talking like turtle pace, you guys. What I do in my practice is I will bring you in for lip filler. We will choose what product is based on your anatomy. I will inject, and then I make you wait 4 to 6 weeks. So like a month to a month and a half before even considering adding more filler. And at that time, I will assess your anatomy and determine if we can add more. If we can add more without your anatomy telling me absolutely not, we will. That is something called lip building. It's layering filler before it has time to break down. So your lips will naturally look, well, not naturally because we're adding filler, but it will look natural, but your lips will look bigger. Your tissue will naturally expand as we inject that product. And I'm going to show you guys, I have been lip building for the last few years. I actually haven't had filler in like 2 years since before Jax was born, and my filler has stayed. So something that's really cool is called the compounding effect. So just because we got lip filler and your friend's filler only lasted for 6 months doesn't mean that yours won't last longer. So the compounding effect is exactly what lip building is. It's adding filler on top of filler in order for it to last longer. So if we compound filler, meaning we build filler, you're going to have a longer duration. So a protocol that I do in my practice for somebody that wants to build their lips is they come in, they get their lip filler. 6 weeks later, we do another syringe. And then at their 6-month appointment, I will do another syringe. So they'll get 2 syringes a year in my practice in order to have the compounding effect. And once we've done that, sometimes I'll have patients where they will come in and we don't need to do their filler at their 6-month appointment. So we wait, we don't do it. We wait a year. Typically with lip filler, you should never, ever, ever be doing your lips more than 1 or 2 times a year once you have successfully built your lips and you have started with the compounding effect. Isn't this so fun, you guys, talking about different product choices, how they matter, how we can fill based on what your anatomy will allow? I am like super pumped talking to you about this. That's one of my favorite topics. Now, something else I want to talk about with how to avoid looking like a duck, because we've already went over product choice, making sure we don't fill past your anatomy, choosing the right injector that will absolutely tell you no, framing the lips in your chin, your cheeks, your deep piriform space. There are 2 other tricks that I like to add for my patients to avoid migration and increase how long their filler lasts. And by increasing how long their filler lasts, you will need less filler, which means less risk of migration. So the 2 things that I will add on for most of my lip filler patients, number 1 are smooth threads. And smooth threads are like teeny little collagen stimulators. They're sugar threads, little mono threads, and how they work, they're like Spanx for your face. You can put them everywhere. In particular, I like to put them in the vermilion border, and that is going to add some definition to the lips. It is going to stimulate collagen. It is going to prevent filler migration. So adding on these little sugar threads to your lip filler appointment can not only increase how long your filler lasts, but they can actually add definition, sharpness, and prevent migration. Another little fun trick with these smooth threads is they can actually lift the lips. So I do something called a lip lift in my practice, and I do it with a combination of filler in the piriform space. And then I use smooth threads, and I literally will stack these. If you picture a hashtag, I stack them like a hashtag, creating this scaffold of collagen to lift and evert the lips. And once I've done that, I can then add filler, and it is like a game changer, you guys. The lips look sharp, crispy, they're not overfilled, they're not overdone. So smooth threads are a really, really good hack to avoid migration and make your filler last longer. The next thing that I like to do for my patients, and this is only if you are a candidate because there's some downsides to this one, is a lip flip. And lip flips often get confused with lip filler because I have patients come in and they're like, well, I'm scared of lip filler. I want to start with a lip flip to make my lips bigger. Well, a lip flip is not going to make your lips bigger. A lip flip works by adding Botox around your lips. So you put it in the muscle and it is going to relax that muscle. And by relaxing that muscle, when you smile, the top of your lip will sit a little bit lower. And if you smile and your lips turn inwards, naturally, adding a lip flip to that area can prevent that. So your lips will look 1 to 2 millimeters bigger when you smile. So if you're a good candidate for a lip flip, you will absolutely love this. And why I like to combo it with my lip filler is because when we relax the muscle around the lips, you can actually make your lip filler last longer. And again, less filler we do, less risk of looking overfilled, overdone, and having filler migration. So because the muscle around our mouth is going to move a lot, we smile, we laugh, we talk, and that muscle can move the filler over time. And it can also make the filler break down faster. So relaxing that muscle is key when you are wanting to make your filler last longer and prevent looking overdone. Now, with the lip flip, there is some downsides, and I'm actually experiencing the downside right now because I got my lip flip done just a couple weeks ago. And what happens is because that muscle is completely relaxed, you almost lose the ability to use your mouth correctly. So you will notice that when you drink out of a straw, it's like super hard. If you try to pucker your lips to give someone a kiss, it's also very difficult. So usually your lips will look great when you smile and when you're at rest, but when you're trying to talk and drink out of a straw, it can be a little bit impaired. So it's something to understand. Is it worth the sacrifice? Some people are like, absolutely not. I cannot lose the ability to drink out of a straw. That will drive me crazy. People like me, I am so obsessed with my lip flip and how it works. Even if it makes talking a little bit more difficult and I can't drink out of a straw, I'm going to choose to get my lip flip done anyways. So thanks for tuning in to today's episode. I am excited to see you guys next week. As a little recap, what we can do to avoid looking like a duck after lip filler is making sure you never, ever, ever overfill. Slow and steady like a turtle, lip build so that you can get the compounding effect and make your filler last longer. Make sure that you frame around your lips. And remember, if your injector says, no, we shouldn't fill your lips today, they make money when they say yes. So listen to your provider. Make sure you're doing filler in the right areas to get the right outcomes. And also choose a provider that is not afraid to tell you no. That's something that is very difficult. In the beginning, I remember from my injecting career, it was harder for me to say no. Now I say no on a regular basis because I'm experienced and I value my patients' outcomes. So I care about how they're going to look in 5 years and 10 years down the road, not just instantly. So that's super, super important. Another thing to remember is adding on smooth threads, little sugar threads can increase your lip filler longevity, prevent migration, and increase the sharpness of your lip border. And also, you can consider a lip flip because for the right person, it is amazing. You may not be able to drink out of a straw, but if your lips look good, who cares? Okay, guys, I will see you next week. Follow me on Instagram at The Perfect Dose.